Start.
Hello, this is Dr. Trivedi, a doctor working in this clinic. May I confirm your name and age?
Hello, doctor. My name is Oshin Bastav and I'm 29 years.
Okay. How may I address you?
Please call me Oshin.
Okay, Mr. Ashin. Today we are going to discuss about your health issues. Is that all right with you?
Okay, doctor.
Okay. And during our discussion, I might take down some notes which will be strictly confidential. Is it okay?
Okay, doctor.
Okay. Now, Mr. Ashwin, can you please tell me in your own terms what have brought you here today?
Doctor, yesterday evening I was playing rugby and suddenly I noticed that I have severe pain on my right side of my chest. And also I developed a shortness of breath at the time. The pain was so severe that I stopped playing and I lied on the field. And after that, my colleagues brought me to the hospital. And after coming to the hospital, they gave me some painkiller medication, gave me some oxygen.
Okay.
And with that, I am feeling good now. And they said that they will do an emergency X-ray of my chest.
Okay. Okay. And was this test done? This emergency X-ray?
Yes, the test was done, but I didn't know that what is the result.
Okay. Okay. That's all right. Well, may I know that you told that it happened yesterday? Am I right?
Yes, doctor.
Okay, and may I know that did this pain come along all on a sudden, or did it develop gradually?
All on a sudden, doctor.
All on a sudden. Okay, and can you please describe the pain for me? How was it? How was the pain?
Pain was so sharp, severe on my right side and right side of my chest and around my axilla, below axilla.
Axilla.
Yes, below the axilla.
Okay, okay, I can get it. And well, can you please tell me for how long did the pain persist?
Before coming to the hospital, the pain was persistent, and after coming to the hospital, they gave me some painkiller medication, and after that, I felt
Okay,
better.
yeah, yeah. Can you please give me an idea how much time did it take to go to the hospital after starting the pain?
About 20 or 25 minutes.
Okay, okay, I can get it. And can you please tell me that during this period, did you feel that there was anything that made it worse, like taking some breath or anything else?
Yes, doctor, I couldn't take much deeper breath, and I felt shortness of breath.
Okay. And did anything make it better during this short time? Just if you could notice, there is
No,
no pressure of it on it. Okay. And if I grade that 0 is no pain at all, and 10 is the highest pain you can perceive, then how would you grade it?
I will tell it is around 7.
Around 7. So it was definitely much
Yes,
severe pain. And can you please tell me that did this pain shift to anywhere else, like in the back or
no,
um, okay. Did you feel any pain in your hands during that time,
no,
or in your mouth or
no,
jaws?
no,
Okay. And did you feel nauseated at this moment? At that moment?
no,
Okay. Or any sweating? Did you feel any sweating?
no.
Okay, that's all right. And may I just know that did you pass any urine at that moment? You have any pass any water work at that moment? Sorry for the word.
No,
Okay. And did you lose your consciousness?
no.
Okay, that's all. Now, you told that you felt some shortness of breath at the same time. Am I right?
Yes, doctor.
Okay. May I know that did this type of chest pain or shortness of breath, has this been the first episode ever, or did you feel this before?
This is the fourth time, doctor, I am having this.
This is the fourth time. Okay.
Yes.
The previous 3 times, has this been all the same all the time, or has this been any difference in the pain or shortness of breath in previous periods, previous episodes, and this time?
This type of pain, doctor.
Same.
Yes.
Okay. I think you have also seek some medical advice previously as well. Am I right?
Yes, doctor.
Okay. Did they make out any diagnosis or anything specific?
Yes, doctor. They say that I have pneumothorax.
Oh, you had pneumothorax. Okay, I can get it. And okay, okay, that's all right. And you told that this time you had shortness of breath. And did this also go away with after taking the medication in the hospital?
Yes, doctor.
Yes. Okay. And previous episodes also, the previous this shortness of breath, chest pain went away after taking those medications.
Yes, doctor.
Okay, that's all right. And did you feel any racing and pacing of your heart during that period?
I notice slightly that is I racing of my heart, and that is usual with everything.
Use it. Okay. And did you feel any cough at this moment? At that moment?
No,
Okay. And any no cough. Okay. And have you ever felt that you have to use extra pillows at night to be more comfortable?
no,
Any leg swelling?
no,
Okay. Now, okay, that's all right. And so now, let's ask me some more questions. Do you have any headache?
no.
Okay. Any problems in your vision? Any problems in your vision have you ever faced?
Yes, doctor.
Can you
I
please elaborate?
uh, I had some problem with my right eyes especially, and after that I needed a surgery for that eye, and they said that I had some problem with my lens.
Okay, okay. That's all right. I can get it. And may I know that do you have any? How do you feel nowadays about your eyes? Is it all right now?
Yes, doctor, I am using spectacles, and with that I'm fine.
Okay, okay. I can get it. And can you? Okay. Do you have any rashes anywhere in the body?
No,
Any oral soreness?
no,
Okay. Any uh, joint pain? Can you please tell me?
no,
Okay. And okay. And have you ever felt that any changes in your any changes in your weight?
no,
Okay. Any raised temperature?
no,
Any weather preference?
no,
Any lumps and bumps anywhere in your body?
no,
Okay. And any weakness in any parts of your body?
no,
Okay. Any abnormal sensation?
no,
Okay. Any difficulty in swallowing or speech?
no.
Okay. What about your water work? May I know?
I haven't found any problem with that.
Okay. And do you have to go more frequently or any frothiness?
No,
Have you ever passed any blood through your water work?
no.
What about your bowel movement?
I think it is fine.
Okay. Any blood in your back passage ever?
No,
Okay. At this moment, may I ask you that do you have any known diseases like high blood pressure or high blood sugar or anything else? Do you know?
no,
Okay. And do you take any medication regularly?
no,
Any over-the-counter medication?
no,
Allergy to any medication?
no.
Okay. And may I ask you now some personal questions. Do you have anyone else in your family having similar type of problems?
Yes, doctor.
May I know who?
My father.
Okay, I can get it. And was he diagnosed?
Actually, my mother got divorced, so I only heard that he had this type of
Okay,
condition.
okay, okay. I can get it. I'm very sorry to learn it. And may I know that how many siblings do you have? Have
I am only child.
Okay, that's all right. And may I ask you some personal questions at this moment?
Okay, doctor.
Okay. Do you smoke?
No,
Do you drink alcohol?
no,
Okay. Do you take any recreational medication?
no.
Okay. And I'm sorry to ask that. May I know that again some personal questions that what do you do for a living?
I work at a university, doctor.
You work at a university. Okay. And do you drive? May
No,
I ask you? Okay. And you work at a university, and you told that this occurred while playing football, rugby. May I ask you that do you play this very often, this sports?
yes, doctor. It is my favorite.
Okay, I can get it. And are you involved with any other sports activity or any diving or anything like that?
No,
Okay, only you play this game. Am I right?
Yes.
Okay. And may I know that did you had any long-term travel history recently?
No.
Okay. And any did you ever had any history of clotting problem or any family history of like this clotting problem or any leg pain, leg swelling?
No.
Okay. And okay. And that's all right. And may I ask you some very personal questions at this moment?
Okay.
May I know whom do you live with?
I'm living alone.
Okay. Okay, that's all right. And may I know that at this moment, may I know that what your concerns are?
Why I am having this frequently, doctor? I am tired of
Yeah,
getting into the hospital regularly. Is it a heart attack or anything else? I am really worried for that. And what will happen? The pain is so
yeah, yeah,
severe, and I don't get any solution. After each time I come to the hospital, I get some medication. I feel better. But will
yeah.
be on all over my life?
Okay, okay. Actually, I can get it. At this moment, actually, I will have to first examine you thoroughly and do some blood tests. May I examine you at this moment?
You can do it later.
Okay. And so, as far as I've taken history from you, I think that it's more likely you are suffering uh, from a condition named Marfan's disease. Have you ever heard of it?
No.
Okay, actually, it's a please don't bother about the term. Actually, it's a condition in which uh, your own cells can your actually it's a term in actually in which different parts of your body can get affected. Okay, it can affect the joints.
Meaning,
It can affect your eyes. Okay, and even it can affect your heart valves as well. And sometimes it can cause some problem in the chest covering, okay, which we say pleura. So we suspect that at this moment I suspect that there is some problem with your chest wall, some chest coverings, okay, for the which you have been facing this problem frequently. And we will however we will at the beginning we will have to rule it out by doing some blood tests and other tests, some scanning tests as well, some electrical tracing of your heart, some x-ray of your chest again, and some other echocardiogram, some other scanning tests of your heart, and as well as some other tests. And we might also have to I'm sorry to say that this there is a chance that this condition runs in families, okay. So actually there is 50% chance of running of this condition running in families, so we might have to go for genetic testing as well. Are you getting me,
yes, doctor.
Mr. Ashwin? Yes. So actually, please don't bother. We will form a multidisciplinary team involving the chest doctor, the heart doctor, the bone doctor, and also the genetic specialist as well. And they will do the arrange the tests as soon as possible. And after doing the diagnosis, they will bring out a very good plan for you as well. And at the meantime, I must say that there is some risk that while you play rugby or some heavy games like rugby, there can be some chance of this condition precipitating, this condition getting worse. So it's better that you refrain from such type of heavy activities or heavy sports. Are you getting me, Mr.
Okay,
Ashwin?
okay, doctor.
Okay. So at this moment, do you have any more concerns?
Uh, is there any permanent solution for this?
Uh, at this moment,
I don't know.
we have to first. Okay, okay. So I would like to do the examinations at this moment.
Okay, go for that.
Okay. So first of all, I would like to tap the chest. Okay. I would like to expose the patient. It would be better if he just takes off his gown and lie down. And then I would like to tap the chest. Is it hyper resonant or whatnot?
Yes,
Okay. Both lung fields?
right.
Right. Okay. Then I would like to auscultate the lung field.
What do you expect?
Diminish breath sound.
Yes, on the right side.
Okay. And then I would like to have a look. I would like to listen to his heart. To his heart. What about it? Any aortic regurgitation or aortic stenosis present on
Regurgitation murmur present.
regurgitation or present? Okay. Then I would like to feel his pulse and collapsing pulse. Whether in collapsing pulse present.
Present.
Okay. And then I would like to have a look at his eyes. Okay. Is there any problem, visible problem?
No.
Okay. And then I would like to please open his mouth and bring out his tongue. And I would have a look at his palate. Is it highly arched?
Yes.
Okay. And then I would go to his hands and just have a look at his hands, whether they're long, thin hands like arachnodactyly present or not.
Present.
Okay. And then I would like to tell him to touch his wrist with his thumb. Can he do it?
Yes.
Okay. And then I would like to tell him to just cross his thumb like this and then make a fist. Does the thumb comes out of his
Yes.
fist? Okay. And okay. And I would also just like to have a look at his neck, whether he has any neck glands or not.
No.
Okay. And I would just have to I would like to just have a look, just have to feel his tummy, and specifically in any sorry, any kidney present or not.
You mean palpable kidney?
Sorry,
You mean palpable kidney?
palpable kidney.
No palpable kidney.
Okay. Or any other organomegaly?
No.
Okay. I think and also I would like to do just a plantar.
Legs are both side.
Okay. Okay. I think that's all for the examination part.
Okay. So have you reached any diagnosis?
Yes, doctor. I think based upon the history that I have taken, the patient is suffering from Marfan's syndrome.
Okay.
And I also some differentials. It can also be a case of Ehlers-Danlos syndrome, I think.
Okay.
And it can also be a main type 2B. Sometimes it can come with Marfanoid habitus, and it can also be autosomal dominant.
Okay.
And I think of considering the long stature, I think he has some long stature. Am I right?
Yes.
I think I can also keep Nile filters as a DD here.
Sorry.
Nile filter syndrome.
Okay. Fine. So have you ever did you ask about his male activity?
No, no. I'm sorry to ask.
Okay, that is not a problem. So how do you like to investigate this gentleman?
Okay. First of all, I will have to do some routine blood tests like a complete blood count to rule out any infective foci present or not. Then also I will have to go for ESR and CRP to look for any inflammation. And then I have to do chest X-ray PA view, post-grad review, to look for any increased translucency. Okay. For any pneumothorax present or not, or any collapse present or not. And then I would also have to do ECG, echocardiography, and ECG echocardiography, urine microscopy, routine microscopic examination and culture, and also I think I would have to do genetic testing for this patient, and others I cannot just remember at this moment, and also thyroid function test, and thyroid function test, I think.
Did you mention CT scan of chest?
No, I mentioned only chest X-ray. CT scan should also be done.
Okay. And in this gentleman, how do you know that how he can be managed?
Yes, actually, it's going to be a multidisciplinary approach. First of all, patient must be educated, and counseling must be done about the disease diagnosis and its prognosis, and its history. And also, there is some genetic counseling should be done, and there are also some lifestyle advice that never to smoke or drink alcohol, and also to give up this type of heavy hectic type of sports activities or heavy exercise as well. Then for I think. Uh, then I will then the other some genetic counseling should be done, and other actually problems should be treated according to according to the complications. Like if since the patient has some regurgitated murmur, we might have to go for some medications, okay, for some labetalol or something like that, and also have to keep him under regular surveillance whether the dilatation, aortic regurgitation dilatation is increasing or not. Okay, in this case, some surgical approach might also be done, and also we will have to follow up his eye uh, and also for pneumothorax, I think respiratory physician would take the responsible decision, which should be what should be done in this patient. I think some I think even some surgical procedures may be done, I think.
Okay. Patient asked about any permanent solution. Are you aware of any permanent
But
solution?
I don't think that there is any permanent solution to it, I think.
Punerectomy or any surgical operation can solve it permanent.
I think pleurectomy or pleurodosis can be done. I'm not sure actually. Can you please tell me?
Okay. So, do you know the other associated features or other associated clinical condition that should be found in patients with Marfan syndrome?
I cannot remember actually. I'm sorry.
Okay, no problem. And during the examination, did you examine the visual field of this patient?
Yes, I would like to examine the visual field and also fundoscope.
Okay. Can there be any back complication in back pain?
Yes, there can be back pain. Marfan's can be associated with back pain. However, if there is back pain, I think uh, we can also consider osteogenesis imperfecta. I'm not sure,
Okay,
but I'm
osteogenesis
not sure.
it can present this way. Alerts and
Marfan's
loss.
can also present with back pain. I'm not sure actually.
Marfan can present with back pain. There is some dilatation,
Okay,
but
okay,
dilated arterioles in the back that
okay,
causes can cause back pain.
okay, okay.
Okay, you did well. I don't have much thing to add.
Okay, so can you please tell me about the DDs? Are they right?
Yes, that's right.
Okay, and so what about the treatment options? You told that any pleurodosis or pleurectomy. Is it correct? I'm not sure.
Yes, recurrent for a recurrent pneumothorax, they can go for the punerectomy. Surgical option,
Oh,
surgical opinion should be taken.
okay, recurrent pneumothorax pleurectomy can be done. Okay,
Yes, that is surgical.
and about
Surgical opinion should be done, and punerectomy is an option.
okay, may I ask that you told that there was some regurgitated murmur. So was my answer correct? That first of all we have to go through some medication like labetalol or something like that, and we have to review him regularly, whether it's more than 5.5 or some. Is that correct?
First, we have to go for the echocardiogram if there is
Yeah.
a need for urgent referral to the cardiologist or not.
Okay. First, we will have to do the echocardiograph, and then the cardiologist will decide whether any surgical option or medication
Yes,
should be given or not.
yes,
Okay.
yes.
Yes. Yes. Okay. Okay. So there is no permanent solution. Am I right?
This can be controlled with lifestyle management with some
Yeah.
option, but there isn't anything that can totally cure this condition.
Yeah. 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 I can get it. And another thing, Marfan's, when I explained it, that you are suffering from a condition named Marfan's, was the explanation all right?
I think the explanation was somewhat messy.
Yeah. Can you please
But
tell me
yes, you could say that
how should have I tell?
we our body is structured by lots of elements, and one of them we call it uh, a fiber like condition. We call it collagen, and there is some defect in this type of condition, so they cannot maintain the laxity, maintain the total elasticity, and also maintain the firm
Okay.
structure of the body, so that they develop this condition.
Okay, okay. So this is an excellent explanation. One of these is what you told, okay, one of this is elastin-like structure, like collagen. Okay.
We call it it is a fiber like structure which our body
Yeah,
is made by lots of elements, and there
yeah,
are
yeah,
one
yeah.
special element we call it fiber,
Yeah,
collagen
yeah, yeah.
fiber. And this condition this maintains the laxity, elasticity, and form of our body. But in your condition, they cannot. There is defect in the fiber, so they cannot make this elasticity and cannot make this that is called farm structure, so that you're having these conditions
Right.
that there are you're having more than usual structure.
Okay, now I can get it.
You are
Now I
having,
can get it. This is an excellent explanation. Thank you for that. Okay. Okay.